Hi everyone, June Fockart here. The medical community has learned the hard way with opioids that intuition and randomized controlled trials which last only a few months don't pick up on serious long-term health consequences. Over the past more than 10 years, America has been fighting a very serious opioid addiction crisis. And now just this past week, the American Academy of Neurology published a position paper calling for doctors and lawmakers to seriously rethink opioid prescription practice and laws. Now, according to the author of the paper, Dr. Gary Franklin, who is a research professor of Environmental and Occupational Health Sciences at the University of Washington, the opioid epidemic is one of the worst man-made epidemics in history. So this epidemic started with policy changes in the late 90s when states began changing laws that had banned the long-term use of opioids, but without evidence that they were safe or effective. Now, according to the paper by the American Academy of Neurology, most of the randomized controlled trials on opioids were actually shorter than 4 weeks, and not a single one was longer than a few months. Now, Dr. Franklin said in an email that the three major misconceptions of the 90s era were that 1. Opioids can be safely and effectively used in persons with chronic non-cancer pain without fear or serious risk of addiction or serious adverse events. 2. That laws put no ceiling on opioid dose. And 3. That the way to treat patients who developed tolerance to opioids was to continue to increase the dose they got. Now, since 1999, opioid sales have increased 300%, a rise that is paralleled by an increase in the number of overdose deaths. Since 1999, over 100,000 Americans have died from opioid-related causes, and the drugs have killed more people ages 34 to 54 than firearms and car accidents. Now, Dr. Franklin is careful to specify that using opioids for cancer pain or end-of-life care is a different matter, and he says that while there is evidence showing that opioids can provide significant short-term pain relief, there is still no substantial evidence that they are good for long-term pain relief or that they improve patients' ability to function long-term without serious risk of overdose dependence or addiction. Now, he said that the biggest lesson to learn from this is that rigorous safety trials are an absolute must before new medical treatments are given to the masses. So just in case you're not familiar with them, opioids are a class of pain-killing drugs derived from poppies, or they can be also made synthetically. They include morphine and commonly known brand names like OxyContin, Percocet, and Vicodin. So if you think you or someone you know is becoming dependent or addicted on an opioid, you should really seek help right away. Just because they are legal and prescribed by a doctor does not mean they are safe.